All right. Hello, everybody. This is Justin Jacobs with Health Plan Markets. And today I'm going to talk about the Medicare Advantage Commissions and how they work together going in from 2019 and then again for 2020. So let's jump in. So first thing I want to show you is Medicare Advantage and how those commissions work. Okay, so Medicare Advantage, or as we affectionately call it, MAPD. There are two ways that you get paid throughout the year, but most importantly, the renewals. And I'm going to come back to how the renewals work with all of this, because that's really why we do what we do. But we have two ways of getting paid for Medicare Advantage. The first is new to Medicare, or new to Medicare Advantage, and a person that is switching. Okay. Now, again, the rates that I'm going to show you here are first for 2019, and then again for 2020, because we've got the new rates that are coming out for CMS. But this is national, so it could vary in your area. So, for instance, in New Jersey, California, you guys make a little bit more, and then in Puerto Rico, you make a little bit less. Based on these numbers. So just check your chart, but this is a basic understanding of how the commissions are paid out by these Medicare Advantage corporations. So for 2019, the amounts for new to Medicare, and this is somebody that is turning 65 or never chose a Medicare Advantage plan in the past, or might be on a Medicare and Medicaid plan and then now joining Medicare Advantage for the first time. This would be a commission of $482, okay? I'm going to put an asterisk there because sometimes that can get prorated, but for the most part, you'll get paid $482. In the year 2020, for business written in 2020 with a 2020 effective date, that amount is now going to $510 for a person that's new to Medicare Advantage. So, sometimes what happens on these commissions is you'll get the prorated amount, meaning that there is a payment due to you. First, what happens is the company sends it to CMS. In the meantime, they pay you the regular prorated amount, which we'll talk about in a second. And then once they verify that the policy is true new to Medicare, they will give you what we call a true up. And that will be the difference between this first payment and this payment to equal either the 2019 $482 or the $510. Okay? So this has not happened. This won't happen until AEP January 1st and forward. That's when you'll start to receive this amount. But for the rest of 2019, the numbers are reflected here on this line here. So hopefully that helps you. All right. So again, they owe you that money if that person is new to Medicare Advantage. Again, there is an asterisk there because I want to talk about how sometimes that does get prorated. Now, for switches, those people that are switching from one Medicare Advantage plan to another, for year 2019, that amount is $241, and this is definitely prorated depending on when you write it in the year. For year 2020, this amount is going up to $255. Again, this is preliminary information with CMS, so this has been an approved amount, so you'll start to see this in 2020 for plans that are written in 2020. So let's see how this proration works, okay? So let's say you write a policy for January 1st, 2019, which passed a couple months ago. You'll get 12 months out of 12 months for that person because they're going to go from January to December on the plan. So you'll get 100% of your commission, which equals $241. Okay, again, this example is for 2019. Okay, 2019. Now, same person, let's say, but they enroll for July 1st effective. There's only 6 months left in the year. So they're only going to pay you for the 6 months that are left, which in this case equals 50% of the year. And so in this example, your 7/1 effective that's switching from one Medicare Advantage plan to another, you'll get paid $120.50 for that member in year 2019. Okay? So the proration depends entirely on when you wrote that policy. Okay? So this is how I do it in my head. The other way to do it is you have a renewal amount. And if you break this number down by month, this number equals $20.08. So if you wrote a policy, all you have to do is figure out, okay, well, there's 6 months left in the year, and you just times that number by 6, and you get the same number, $120.50. So there's different ways to do it mathematically. This way works for me, but whatever's clever, as long as you understand the concept. So the renewals, this is why we do the business. So this is when you wrote the business, so you get initial commission. So these two examples are what we call initial commission. And then we have renewals. Renewals always start on January 1st. So in this example, if we're talking about business written in 2019, the policy renews in 2020, and January 1st, 2020. So all the business you wrote here will be renewed in January, and here will be renewed in January, and you will receive a per member per month of $20.08, and we call that PMPM. Okay? So again, if you have 100 members that you enrolled during 2019, you are now earning a monthly residual check of approximately $2,008. So this gives you a good snapshot of how commissions work for 2019 on the basics. Now, we talked about this asterisk here. So what I'm going to do here is switch to a new page. Hopefully this works here. There we go. And same example here. So this is somebody that's Medicare Advantage, and this is the first time they're joining MAPD. So we're going to start with the standard $482. Okay, this is 2019. But what happens is sometimes this number is prorated. Why is it prorated? Well, sometimes what happens is you have a member that did enroll into Part D, so they have a standalone Part D plan, or they were automatically enrolled in Part D because they had low-income subsidy, and sometimes the low-income subsidy is triggered because this person has Medicaid, okay, or additional assistance through the state. So when they get Medicaid, it triggers LIS, and because you have LIS, the federal government automatically assigns you a Part D program. So you'll run into people that are on Part A, Part B, and Part D, and may have been on it for many years, and then they meet you, and you switch them over to Medicare Advantage. Now, depending on when you wrote this person, this could be prorated. So if you're lucky enough to get them on January 1st, you'll get $482. However, if you meet this person on 7/1, remember there's 50% of the commission because there's only 6 months left in the year, you'll get $241 for that new to Medicare member. And again, it's only prorated if they have a Part D program. If they do not have a Part D program, then you'll receive the full $482, again, sometimes in one payment or sometimes in two, depending on how the company operates their commissions. Okay? So same example here. We're going to talk about how new to Medicare is going to work in 2020. So same example. So we've got MAPD for 2020. Again, new to Medicare this year coming up is $510. Yahoo! So $510 if they do not have Part D, so no Part D. Anytime during the year, you'll get the full $510. Again, it could be in one or two payments. Okay? But you are due the full $510. If you meet the member and they already have a Part D program, then you will get the $510. However, it could be prorated depending on when you wrote it. Okay? So again, if you wrote that business and that person was, you met them in July, you'll only get 50% of the commission, and that's $255 for new to Medicare, because and only because they had Part D already established. Okay, so the proration on new to Medicare is triggered entirely on whether or not they already have a Part D program. So I've been asked questions, hey, how come I didn't get the full amount this year? Why didn't I get the full $482? It's because that person already had a Part D, and it's because you wrote them at a different time of the year than 1/1 effective. Okay. Now the good news is when that policy renews in 2021, okay, when it renews, you are earning $21.25 per member per month, whether they're new to Medicare or they're not. Remember, the switch is at $255. Again, you just divide it by how many months are left in the year. So there's 12 months in the year, and that should give you your equation. Okay, or you can take this number, $21.25, and times it by how many months are left in the year, and that'll also give you the commission due. Okay? So hopefully this commission training has helped you understand a little bit better about how commissions work for Medicare Advantage for 2019 and moving into 2020. If you have any questions, feel free to give us a call, 844-696-3975, or visit us at joinhpm.com. That's JOINHPM.com. Thanks again, and have a great day.